How to complete the Plan ID Crosswalk template. Issuers seeking to offer qualified health plans, or QHPs, including standalone dental plans, or SADPs, on the federally facilitated exchange, must submit a completed QHP application per CMS guidelines. As part of the QHP certification process, issuers are asked to fill out several templates with issuer and plan level data. These templates, along with any supporting documentation submitted, comprise an issuer's QHP application. Among these templates is the Plan ID Crosswalk template. The Plan ID Crosswalk template crosswalks standard component ID and service area combinations from the previous plan year to a plan ID for the upcoming plan year. For this reason, issuers that did not offer plans in a state in the previous plan year, including first-time QHP issuers, are not required to complete this template unless the issuer is receiving plans from an issuer that is not returning to the exchange for the upcoming plan year, and is also in the same parent organization and state as the receiving issuer. The data entered into this template facilitates 834 enrollment transactions from CMS to the issuer for existing enrollees in the individual market who do not actively select a different QHP during open enrollment. Before filling out the Plan ID Crosswalk template, you'll need to complete the Plans and Benefits template and the Service Area template. You'll also need completed versions of these templates from the previous plan year. Additionally, issuers are expected to submit evidence from the state, such as an email confirmation, that the issuer is authorized to submit its Plan ID Crosswalk template. Issuers are required to submit this evidence by the date published in the QHP Data Submission and Certification Timeline Bulletin. Any subsequent submissions of an issuer's Plan ID Crosswalk template should include an updated state authorization form. Issuers in states that do not enforce Patient Protection and Affordable Care Act, or PPACA, market-wide requirements should submit the authorization form to their state and to CMS's Compliance and Enforcement Division to obtain the necessary authorization for submission. Please note that if an issuer has data issues or variances from the required regulations in their Plan ID Crosswalk template, the issuer must submit justifications explaining why the crosswalks are in compliance. Issuers must submit justifications for specific validation warnings received when submitting an application in the Marketplace Plan Management System, or MPMS, module within the Health Insurance Oversight System, or HIOS. To complete the Plan ID Crosswalk template, returning issuers and issuers that are new to the exchange and receiving plans from a discontinuing issuer are strongly encouraged to generate and download a pre-populated template from the Application Materials tab of the MPMS module in HIOS. This pre-populated template will import the plan IDs that the issuer submitted in the previous plan year and the associated service areas and network IDs. To download the blank Plan ID Crosswalk template, state authorization form, and applicable instructions, visit the Plan Crosswalk webpage of the QHP certification website. This webpage contains more information about the Crosswalk section of the QHP application, including tips and additional resources. Before filling out the Plan ID Crosswalk template, download and read the instructions from the Application Resources section. Once you're ready to complete the Plan ID Crosswalk template, download the template and state authorization from the Application Resources section and save them to the same folder on your computer. Open the template and enable macros in the template. The Plan ID Crosswalk template is divided into two portions: the 2026 Plan Crosswalk tab and the 2026 Plan and Service Area Data tab. A 2027 Plan Crosswalk tab will be created based on your entries in the 2026 Plan Crosswalk and 2026 Plan and Service Area Data tabs. When filling out templates in the QHP application, start in the top left corner and fill out fields moving down and to the right until all required fields are completed. Now let's walk through filling out the Plan ID Crosswalk template with sample data. Before you begin, look through the data elements required to ensure you have the necessary plan information to successfully complete this template. To start, navigate to the Action section of the 2026 Plan Crosswalk tab and click the Import 2026 Plans and Benefits and Service Area Template button. The template will prompt you to select your completed 2026 Plans and Benefits template and 2026 Service Area template. Note that the Plans and Benefits and Service Area templates must be saved in the same folder and must be selected at the same time. Click Open. You must select exactly one Plans and Benefits template and one Service Area template. The template will populate a list of Plan Year 2026 plan IDs and their associated service areas on the 2026 Plan and Service Area Data tab. Review this tab to ensure the data was accurately imported. The 2026 Plan Crosswalk tab will be populated with all applicable issuer information, as well as a row for each Plan Year 2026 plan ID. Review the following data fields for accuracy: iOS Issuer ID, Issuer State, Market Coverage, and Dental-Only Plan. Once you've confirmed that the issuer information is correct, select the crosswalk level. From the drop-down menu, select the level at which you would like to crosswalk each Plan Year 2026 plan. Select from the following options: crosswalking to the same plan ID. Select this option if you are crosswalking your Plan Year 2026 plan to the same plan ID for Plan Year 2027 and you have no service area contractions. Crosswalking at the plan ID level. Select this option if you have no service area contractions but are using a different Plan Year 2027 plan ID to reflect the same plan. Crosswalking at the plan ID and county coverage level. Select this option if your service area changed for the upcoming year and you need to crosswalk your Plan Year 2026 plan to 2 or more Plan Year 2027 plan IDs or discontinue the plan in some counties. Note that if your Plan Year 2026 plan covered the entire state, you will need to crosswalk the plan for every county in the state. Crosswalking for 1 or more counties at the zip level. Select this option if your service area changed for the upcoming year and you need to crosswalk your Plan Year 2026 plan to 2 or more Plan Year 2027 plan IDs or discontinue the plan in some zip codes within a county. Selecting this option will require you to select the counties from the Plan Year 2026 plan service area that will be crosswalked at the zip code level. The remaining counties in the Plan Year 2026 service area will be crosswalked at the county level. Note that CMS discourages issuers from crosswalking at the zip code level unless absolutely necessary. Discontinue with no crosswalk. Select this option if you are discontinuing a Plan Year 2026 plan with no re-enrollment option for its enrollees. Plan withdrawn prior to certification. Select this option if the Plan Year 2026 plan was withdrawn from the exchange prior to certification and has no enrollment. Issuers should also select this option if the Plan Year 2026 plan ID listed on the template was not approved by the state or CMS to be offered on the exchange in Plan Year 2026. If you selected crosswalking for 1 or more counties at the zip level, move to the next field and select from the pop-up menu which counties in your Plan Year 2026 plan service area will be crosswalked at the zip code level. Complete these steps for all Plan Year 2026 plan IDs until you have completed the 2026 Plan Crosswalk tab. Now let's walk through creating and filling out the 2027 Crosswalk tab with sample data. To finish completing the Plan ID Crosswalk template, navigate to the Actions section and click the Create 2027 Crosswalk tab button. This action creates one 2027 Plan Crosswalk tab. Note that you should only click the Create 2027 Crosswalk tab button when you are sure the 2026 Plan Crosswalk tab is complete. If you make changes to the 2026 Plan Crosswalk tab after the 2027 Plan Crosswalk tab has been created, you will need to click the Create 2027 Crosswalk tab button again, which will clear all data already entered on the 2027 Plan Crosswalk tab. The first 4 columns of the 2027 Plan Crosswalk tab are 2026 HIOS Plan ID, county name, service area zip codes, and crosswalk level. These columns will auto-populate based on your entries in the 2026 Plan Crosswalk tab. If you decided to crosswalk at the Plan ID county level for 1 or more plans, a row will appear for each county that plan covered in Plan Year 2026. If the user decided to crosswalk at the zip level for specific counties covered by a Plan Year 2026 plan, a row for each Plan ID county zip code combination will appear. The next field asks you to provide the reason for the crosswalk. The crosswalk reason will depend on the crosswalk level selected. The possible list of crosswalk reasons includes renewing exact same product plan combination, same 2026 plan ID, Select this option if you are crosswalking this Plan ID service area to the exact same Plan ID. Under this option, the template will auto-populate the Plan Year 2027 Plan ID field with your Plan Year 2026 Plan ID. Issuers should use the same Plan ID if the same plan was offered the previous plan year and remains available for Plan Year 2027. Renewing exact same product plan combination, different 2027 Plan ID. Select this option if you are crosswalking this Plan ID service area to the same product plan combination, but with a different Plan Year 2027 Plan ID. In most cases, issuers should use the same Plan ID if the same plan was offered the previous plan year and remains available for Plan Year 2027. In the limited cases where an issuer is continuing the same plan, but has a need to crosswalk to a different Plan ID, the issuer should seek guidance and approval from their state regulatory authority prior to submitting their Plan ID crosswalk template to CMS. Renewing product, renewal in a different plan within the product. Select this option if you are renewing this product, but crosswalking this Plan ID service area to a different plan within the product offered through the Federally Facilitated Exchange, or FFE. If you select this option, you must use the same product ID embedded in the plan's 2026 Plan ID. Continuing product, no plan available in the particular service area under that product. Enrollment in a different product. Select this option if you are continuing this product in Plan Year 2027, but will no longer offer any plans in part of the service area covered by the product in Plan Year 2026, and are crosswalking to a plan within a different product offered through the FFE. Select this reason for that portion of the service area that you no longer offer any plans under that product. If you select this option, you must crosswalk to a Plan Year 2027 Plan ID with a different product ID from the Plan Year 2026 Plan ID. Continuing product, no plan available in the particular service area under that product. No enrollment option. Select this option if you are continuing a Plan Year 2026 product, but there is no plan under this product available to crosswalk to for this plan service area combination. Issuers may not enroll pertinent plans into a plan offered outside the exchange. Note that selecting this option will disable the 2027 Plan ID field. Discontinuing product, no enrollment option. Select this option if a Plan Year 2026 product is discontinued for Plan Year 2027, and there is no enrollment option through the FFE for Plan Year 2026 enrollees in this Plan ID service area combination. Issuers may not enroll pertinent plans into a plan offered outside the exchange. Selecting this option will disable the Plan Year 2027 Plan ID field. Issuers should crosswalk any discontinued Plan Year 2026 plan to an available plan in a different product, if one exists. If an issuer does not provide a crosswalk for a discontinued plan, but still offers products in the same service area, CMS will crosswalk the discontinued plan to another product offered by the same issuer under the same issuer ID. Discontinuing product, enrollment into a different product. Select this option if this Plan Year 2026 product is discontinued for Plan Year 2027, and enrollees in this plan and associated service area will be re-enrolled in a plan under a different product offered through the FFE. Under this option, the entered Plan Year 2027 Plan ID must have a different product ID. Issuers should crosswalk any discontinued Plan Year 2026 plan to an available plan in a different product if one exists. If an issuer does not provide a crosswalk for a discontinued plan, but still offers products in the same service areas, CMS will crosswalk the discontinued plan to another product offered by the same issuer under the same issuer ID. Continuing product, no silver plan available in the particular service area under that product. Enrollment in a silver plan under a different product. Select this option if there is no available silver plan within the enrollee's product in a particular service area, and the enrollee is being enrolled in a silver plan within another product. Next, enter the Plan Year 2027 Plan ID that you would like to crosswalk your enrollees to for the Rose Plan Year 2026 Plan ID and service area. This field will be auto-populated when renewing exact same product plan combination, same 2026 Plan ID, is chosen under the reason for crosswalk. This field will be disabled when discontinuing product, no enrollment option, or continuing product, no plan available in the particular service area under that product, no enrollment option, is chosen under the reason for crosswalk. Note that issuers should only input Plan Year 2027 plan IDs for plans that will be offered through the exchange and are listed in their Plan Year 2027 QHP application. CMS will not accept any Plan Year 2027 plan IDs for plans only sold outside the exchange. Next, indicate whether this plan is a catastrophic or child-only plan. This field will default to no. If you select yes, the next field will allow you to enter a Plan Year 2027 plan ID for enrollees who no longer meet the criteria for continued eligibility in these plans. The next 6 fields related to policy form numbers and NAIC CERF tracking numbers are optional and should only be completed if requested by your state regulator. Follow these steps for all Plan Year 2026 HIOS Plan ID and Service Area combinations listed until you complete the 2027 Plan Crosswalk tab. Now let's validate and finalize the template. Once you have completed the template, navigate back to the 2026 Plan Crosswalk tab and click the Validate button in the Actions section. Any data issues in your template that need to be resolved will be displayed. Correct these and click the Validate button again. Continue this process until all errors have been resolved. Once the template is valid, click the Finalize button to create an XML that will be automatically saved in the same folder as the template. The XML extract is the file you will submit as part of your QHP application. You should not change the name of the XML extract before submitting it to CMS. If you have questions regarding your QHP application, please contact the Marketplace Service Desk at cms_feps@cms.hhs.gov or 855-CMS-1515. For more information about the QHP certification process, visit www.qhpcertification.cms.gov.